Welcome to your Invisalign journey. In this video, I will be explaining you about how to use the Invisalign and fit it into your lifestyle. The first thing we need to remember about Invisalign is we need to wear it for at least 20 to 22 hours. When I say 20 to 22, I mean an average of 21 hours. So let's look at it, that how you can actually fix it in your lifestyle of wearing it for 21 hours. See, we have 24 hours in a day, out of which 8 hours is what we sleep. So that is the time where the maximum amount of Invisalign is going to be effective. The remaining period is 16 hours in a day. So you have to remember, you have to take out Invisalign while eating, while brushing, and while having anything hot. So let us say we eat 3 meals in a day. So that will total it up into 30 minutes, 30 minutes and 30 minutes. We have 2 tea and coffee breaks, again 30 minutes and 30 minutes. And then we have 2 personal hygiene times of 30 minutes and 30 minutes in the morning and evening. If I take a total of this, that will be 3.5 hours. Now, so that gives us 20 hours to wear our Invisalign aligners. So we have to take an average of at least 20 to 22 hours, on an average. Now your orthodontist who is going to be treating you will let you know as per your case whether you have to change your aligners every 7 days or every 10 days or every 12 days. Normal cycle in most of the cases is anything between 7 to 10 days cycle. So we have to remember that if we are wearing it for a period of 7 days, that means we have to wear each aligner for approximately 140 hours in a week. So that will bring about the success of your treatment is your compliance. The next instruction is you have to understand how to identify each and every aligner. Invisalign has a very beautiful packing in which all the numbers are written on the packet. Simultaneously, if we actually look at the aligner, there is at the bottom of the aligner, there is a laser marking which carries the original Invisalign logo and the numbering. So your upper will be labeled as upper U, then the number of the aligner which is 01 or 02. And subsequently the lower one will also carry the L mark along with 01, 02, 03 like this. Every time you finish with the aligner, what you need to do is you put it back into your packet and write in the notes section that when did you stop wearing your aligners. The next instruction is how to take it out and how to position it. Yes, initially you may find it slightly difficult when you're wearing a brand new aligners. So as a result of which you might find it a little difficult to take it out. Do not worry about it. Invisalign will fit into your lifestyle and it will become extremely easy later on to put it on. Please ask your Invisalign provider to explain how to take it out to you. The ideal manner is to first position it on the front teeth and then on the back teeth. While taking it out, please remember we have to use our index finger or the thumb and always take it out from the inside and dislodging it outward. So that way, that will give us ease of taking it out. Once you have learned how to take it out, now we come down to maintaining the Invisalign aligners, on how to keep it clean. Remember that we have to clean it twice in a day. Every time when we are going to be brushing, we will put on aligners using a normal brush, a normal toothpaste and water. First we will brush on top of the aligners, then we will take out the aligners and we will brush on the inside of the aligners. During the day, whenever we are going to be taking out the aligners for the purpose of eating and brushing, we just need to take it out and make sure we put it in that beautiful box which is being provided to you along with your Invisalign aligner set. Now, after you have done it, before putting it on, in case you have eaten something very heavy, please rinse your mouth nicely, then rinse the aligners with normal water and then put it on. Let us just come down to some basic, frequently asked questions. The first thing, what if I lose my aligner or if my aligner breaks? Do not worry about it. The aligners are made to move in a sequential manner very selectively. So even if you lose it, do not worry. Try shifting first onto your next aligner stage. Once you have shifted to the next aligner stage, take the chewies or the aligner chewies which have been given along with you, or the tissue paper bites, to tightly position it. Once you have positioned it, you will see in a day or so the new aligner automatically fits in. And wear that aligner a little extra, to make sure that you come back into the cycle. Initially, you will have a little bit of speech issues for a period of 1 or 2 days, in order to get used to the aligner inside the mouth. You have to understand it is a foreign object. So our body will release a lot of saliva in the first 1 or 2 days. Now, in order to make sure that the saliva reduces, we would like you to have a lot of water during the first 2-3 days. Simultaneously, every time we shift the aligner, your teeth will feel a little sore. Now, don't have to worry about it. The soreness will go off in the next 2 to 3 days. Every time we change an aligner, your soreness will be there only for a day, and maximum it will stretch down to the first 4 or 5 aligners. Now, every time remember when we are going to be shifting onto our next aligner. So let us say if you're shifting from the number 2 aligner to number 3 aligner, we will always have to change that aligner only in the night before going to sleep. And it should always be changed into a continuity. So the momentum should be maintained. It's like a relay race. Okay, so let us say if you're having your dinner, after dinner wear your number 2 just before going to sleep. Shift on to your number 3 aligner, and then on that day use a lot of chewies to make sure your aligners settle down properly. It is always a good habit to make sure you use your chewies every night before you go to sleep. Now remember that you cannot eat anything with the aligners on. So that is very, very essential, because that can cause a lot of staining onto your aligners. But you can drink everything with the aligners as I told you, but nothing hot. So please avoid tea and coffee and anything which is extremely colored. So let us say if you're going to be having something like a cranberry juice or like a red wine, then please take it out. Otherwise, your normal milk products and everything, you can have it, preferably with a straw. Never eat a chewing gum with the aligners, and it is always advised not to have anything related to tobacco with the aligners in your mouth. Okay, you would have seen that there are some bumps and ridges onto the aligner. Now they are responsible, they are components of the of the Invisalign system, in which the attachments which are placed onto your teeth, these attachments are the ones which will help to hold the aligner and give the right direction of force for the teeth to move in a particular direction. Simultaneously, there will be some pressure points and some ridges onto the aligner. So these are all components of the aligner. In case any of the attachments hurts you or comes out, you do not have to worry. Your Invisalign provider will be doing regular checkups. In that, the first thing that is going to be checked up is whether your attachments are in place or not. Now, in order for us to monitor you well, we would want that you should please download the My Invisalign app and please take photographs inside the app. So as a result of which, we are able to virtually monitor your progress. It is advisable every second or third aligner stage, you should be uploading the photographs in the My Virtual Care section. I think this clarifies most of your doubts. In case you have any more doubts, please refer to the app. It has a lot of answers to your basic FAQs. Okay, so all the best for your Invisalign journey from Love My Smile, providing you happier, healthier smiles.